Hello, my name is John Missig. I'm a bachelor's degree program nurse with Southern New Hampshire University, doing a comprehensive or a pseudo-comprehensive health assessment for NUR 325 nursing program. I have with me today my volunteer patient. We're going to refer to our patient for HIPAA purposes as Liam. How are you today, Liam?
I'm doing great. How about yourself?
Excellent, excellent. Before the assessment, from some perspectives, we're doing some of this as assessment and some of it as a pseudo-assessment. For the purposes of this discussion, we took his temperature, pulse, and respirations before the start of the assessment. Temperature was 98.6, pulse 118/58. Respirations were 14, and his pulse was 75. So ordinarily in this assessment, I'd enter the room, I'd introduce myself to the patient. Hello, Liam, my name is John Missig. I'm a registered nurse here and part of the treatment team at Shadow General Hospital, and I'm here today to do your comprehensive health assessment. And at this point now, I would generally have the patient's chart, something with the patient's demographics on there, and each facility has a specific identifier system. In this case, we would use the ID band, and we would use the patient's name and date of birth. And you can make up a date of birth for me, but I would look at the ID and say those things, and they'd say, okay, can you tell me your full name? And just say, what's your first name, Liam, and what's your date of birth?
February 12th.
Excellent. Terrific. Feeling today?
Feeling excellent.
Good. Are you having any pain or anything that you'd like to report when it comes to your health right now?
No pain. Feeling great.
Terrific. Terrific. Okay, so we're going to start what's called, you mind if I take your hat off?
Absolutely.
Terrific. So we're going to set, what this is called is essentially a head-to-toe assessment, right? So we're going to start with assessing your head, your eyes, your ears, your nose, and your throat, okay? Are those prescription glasses?
They are, yes.
Excellent. How's your vision without prescription glasses?
Without them, not too good.
Not too good.
Terrible.
Okay. Any difficulty with your eyes? Any history of eye problems, pain?
No.
Terrific. Do you mind if I take your glasses off?
Yeah, absolutely.
Thank you. I'm going to just start with your eyes here real quick and just make sure that you let me know if there's any difficulty or pain in your eyes. Your conjunctiva is nice and pink the way it should be. And excellent. I'm just saying this is kind of part, I'm going to do a little bit of everything at one time, but this is part of it's called of a neurological assessment of your eyes. I just want you to track my finger with your eyes if you could. Terrific. Terrific. Excellent. All right, I want to go from behind, and I'd just like you to let me know when you see my finger come into your peripheral vision. Now. Good. The other side?
Now.
Good. Excellent. Terrific. So now I'm just going to feel your sinuses. Do you have any pain or anything in your sinuses?
No.
Any seasonal allergies or anything in this?
Not at the moment, no.
Not at the moment? Good. What about your ears?
No. Feels fine.
No pain in your ears? Sure. Ordinarily, I'd have an otoscope. I don't have one, but I'm just going to look in your ears, and there'd be a light, and your ears appear normal. Do you have any difficulty or any hearing loss?
No.
You hear well? Good. I'm going to do a thing called a whisper test, okay? And when I whisper in your ear, I'm just going to whisper a number, and just to see if you can repeat it back to me.
2.
Excellent.
5.
Terrific. Well done. I'm not that good a whisperer.
Yeah.
I'm slightly hard of hearing. So anyway, so good. So no problems with your ears or your hearing.
Nope.
No problems with your sinuses. I'm just going to feel your temporal arteries. Feel your head. Just see if there's any lumps or anything unusual when it comes to your head that you're aware of.
Not to my knowledge, no.
Good. Good. So I'm going to feel your carotid artery on one side over here first. I'm actually going to listen to it with a stethoscope. What you're looking for is called a bruit. If there's any unusual sound. Okay. Excellent. No problems?
No.
Sorry about that.
All good.
So no problems there. Terrific. Now, next is I want you to just, when it comes to your head, I want you to just lean your head to the left. Now back to the right. Turn all the way to your right. All the way to the left. And just lean back. Any difficulty or problems there?
No.
Good. I want you to now turn your head and try to the right, and try and just push back against my face my hand as you turn. So, let's start over. I'm just going to hold it here, and I'm going to put a little pressure against it, and you're just going to turn against my hand.
Okay.
Go ahead. Good. Now we're going to do the same thing the other way. Good. And down. Good. Excellent. And just back. Good. Excellent. Well, everything is looking normal so far. I'm going to do what's called that. I'm just going to assess your thyroid and feel if you have anything unusual in your thyroid, any enlarged lymph nodes on your face. And everything seems perfectly normal there. All right. While I'm here, I'm going to just assess your chest as well. Just kind of feel, mine. And normally we would do this with no shirt on, but I'm just going to do, guys can have breast cancer and so can girls. And obviously you're working out. Yeah?
Mm-hmm. Yep.
How often do you work out?
5 days a week, 2 hours a day.
Good. Do you know how to check your chest for any lumps? Is that something you do?
I do, yeah.
Good. Excellent. Now, if you wouldn't mind just lifting up your arm, I'm also going to feel under your armpit to see if I feel any enlarged lymph nodes in your armpit area, which I do not. Have you noticed anything unusual or enlarged on your armpits or anywhere else?
Not, no.
No lumps anywhere unusual on your body?
Nowhere that I can think of now.
Well, that's good news. All right, so your eyes, we looked at it, and what I need to do next is just look at your mouth. And normally I would have gloves on. I don't have gloves on because we're family. But just do me a favor, just take your lips and down like that. Excellent. Nothing unusual there. Up on the top, same. And then just open your mouth and stick out your tongue for me. Wiggle it to the left, wiggle it to the right, up, down. Good. You ever have any difficulty swallowing or anything like that?
Never.
Good. You brush your teeth daily?
Twice a day.
Twice a day. Do you floss?
I do every night.
Excellent. It's a good, it's an appropriate hygiene thing. People who don't floss do have a higher risk of heart disease and heart problems, actually, they say.
Yeah.
So, good. Eyes-wise, do you have any family history as far as blindness, color blindness, or anything like that?
No, not to my knowledge.
Good. Next is I'm just going to listen to you. So we're working our way down your body, head to toe, okay? And let's just see time-wise, 9 minutes, I think. So we're trying to do this in around 30.
Okay.
All right, so I'm going to listen to your lungs, and I'm going to start at the front and then move to the back. All right, what I want you to do is just breathe normally in the front. All right? Good. Good. Now on the back, I want you to take deep breaths. Deep breath. Good. In and out. 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 Good. One more, two more. Good. Last one. Good. So what I hear from you is you're looking for rhonchi, rails, wheezes, and what you have is what they call normal vesicular breath sounds. So that's excellent. All right. So next step in the exam would be to do. Let's move on to your abdomen. Okay.
Okay.
So normally what we would do is, I would actually lay you down. I might have you stand up. Let's stand up just real quick. And I'm just going to assess the symmetry of your body and make sure that, symmetrically there's nothing bulging out this side or this side. And, obviously you're, working out regularly. Looks like you're working hard on symmetry. And turn around real quick, and I would do the same thing, assess symmetry on your abdomen. And, we're looking for different things such as like a hernia or, a mass, that would cause it. You can sit back down.
Sit back down. Okay.
All right. So next is what I would do is it's called auscultation, palpation, and deep palpation, and percussion and deep palpation. Right. So you start by listening to your abdominal sounds. You essentially have 4 quadrants in your abdomen. Right. So I'm going to listen to each quadrant, and starting with your right lower. Good. 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 You have very normal bowel sounds. How about your bowels? Do you move your bowels on a daily basis? Every other day? Every third day?
Yeah, every day for sure.
Every day? More than once a day, or
twice a day usually.
Twice a day. How would you describe your bowel movement? Would you say it's by normal being firm? Is it hard? Is it soft?
I would say consistently firm.
Firm?
Yeah.
Okay. So would you describe that as normal for you?
I would, yeah.
Okay. Good. Ever have any bleeding or anything like that?
Never. No.
What about family history? Do you have any family history of any bowel problems?
Nothing with bowel problems, no.
No. Okay. Good. Good. So you've never had any bleeding when you go to the bathroom? Any straining?
No.
What about hemorrhoids or anything like that?
Nope.
Terrific. Okay. The next stage is I would do what's called percussion, and I'm going to tap here, and as I tap here, your liver is actually right here, right? So you're tapping here, and I'm looking to see if your liver is resonating below your rib cage. I mean, it can be slightly below your rib cage, but it really shouldn't be. It should be, at your age especially, it should be above your rib cage.
Yeah.
And if it was a centimeter below, that would be, it might be normal, but I hear normal percussion sounds. So from there now, what I'm going to do is what's called a deep palpation, and the same thing is that I would do that with you laying down, but since our environment doesn't allow for that, I'm just going to kind of feel in here and see if I feel anything unusual as far as your liver goes. See if I can feel, your gallbladder, and in this area. Everything. Do you feel any pain when I do this? Good.
You kind of gotta go pee, so.
All right, so I won't go too much further on that for you. All right, so essentially what I'm looking for is masses and things of that nature. And the same thing is now you would look to go deep palpation and see if you could feel your kidneys as well could be felt here, especially if they were enlarged in any way. And in your case, everything is. From a pseudo assessment perspective, everything is normal. Lungs, I didn't get. Let me just get back to lungs real quick. Do you have any family history of lung disease, heart disease, emphysema, or anything like that?
No. Yeah.
Okay, good. What about coughing or anything like that? Do you notice you cough, or do you find yourself while you're in bed at night sweating at night, or anything that more unusual?
No, nothing unusual. Only when I like have a cold or something, but at the moment I'm good.
Good. Never ever cough up blood or anything like that?
Never. No.
Good. How about endurance-wise? When you run, are you able to you have some endurance? Do you feel short of breath when you walk up the stairs?
No, not at all.
What about tobacco use? Do you use tobacco or any form of tobacco products?
No.
All right. What about drugs or marijuana is become these days in your age?
No.
Marijuana or
No, pursuing nursing school myself. So
there you go.
No marijuana.
Smart decision. And then what about any other drugs? Do you currently take any drugs at all?
No.
Any medications? Is it prescribed or unprescribed?
Nope.
Vitamins, is it prescribed or unprescribed?
No.
No. Okay. Good. So overall, then, stomach-wise, you've not noticed any masses, any pain, any difficulty. What about GERD after you eat? It's gastroesophageal reflux. And sometimes when people lay down after they eat, they'll feel heartburn. Mom calls it agita.
Yeah. Maybe if I like Chipotle or something, but yeah, other than that, no.
On a regular basis,
Yeah, it's uncommon.
Okay, terrific. So the next thing is I'm gonna assess, and it's part of the kind of GI assessment. This is I would, and again I'm gonna kind of pseudo assess that as if we would assess you for a hernia. So we're like to kind of feel in here to see if there's any bulge of your intestine kind of tears through the inguinal area, and there's a piece of intestine that's kind of hanging through there. And I obviously don't feel anything, and testicular-wise, we would do the same thing. Your intestine could essentially fall into your testicles, and we'll just go reported-wise. Or do you have any problems when it comes to that? Do you notice any bulges, anything unusual in your genital area?
No.
So, how about going? So next would be urinary. Is to identify. Do you have any? In your kidneys are about here on your back. You notice any back pain or any unusual pain in your that might be kidney related?
No.
How is your fluid intake on a daily basis? How much fluid would you say you take?
I probably drink close to a gallon of water a day.
A day?
Yeah.
Okay. Good. And when you go to the bathroom, what color would you say your urine is?
Clear. Occasionally a little bit of yellowness, but usually
For the
clear.
most part, clear. Okay. Any difficulty when you go to the bathroom starting the stream or stop? You can just go to the bathroom without any difficulties.
No difficulties at all.
Good. Well, at some point as you get older, you might start to have difficulty starting or stopping, and that would be an indication that maybe your prostate is enlarged or starting to enlarge or needs some further attention. You should be able to urinate freely without difficulty. So good for you that you're able to. So terrific. Next is I'm just going to assess. I would assess your coordination as far as your hands go. This is neurological. I didn't have you touch your nose yet or anything like that, right?
No.
So so I want you to go ahead and touch your nose. Put your hands out like this for me, and just touch your nose. And same with the other hand. Now touch your chin for me. Same with the other hand. Terrific. That's how it's supposed to be. I want you to just put your hands out for me. I'm going to push down, and I want you to push up against my hands real quick. And let me, good. Now you're strong. Same thing now. Push down, I'm going to push up. Good. And same thing now. Just go the other way. And you try and push out. Good strength. Squeeze my fingers here for me. Excellent. Let me just look at your fingers here, and we're just going to check it's called capillary refill. And if you see how your fingers turn from pink to white, it should be less than 3 seconds that they fill back to pink. And in your case, they fill back nice and quickly. So that's a brisk and normal capillary refill. We'll do the same on the other side. Good. You ever have any problems with tingling or decreased sensation in your hands? No? Okay. I want to just close your eyes real quick, and I'm going to just use this little thing here. If you just look at me, put your hand out for me real quick. And I'm just going to say, this side is sharp, right?
Yeah.
That side is dull.
Yep.
Right? And, I'm going to, I'm sorry I did not prepare something for salt. Give me 1 second.
What are you looking for?
All right, so we just say this is salt, right?
Okay.
Okay, so you just tell me which you're feeling.
Okay. Felt sharp.
Okay, put your other hand out.
Sharp.
Good. That just leave them both out for
Okay,
me.
yeah. Sharp. Hard. Hard.
Well, I didn't do a good job on the soft thing.
Soft. With the water up.
So, yeah, sorry.
Felt like the blunt end. Soft. Hard.
There you go. And
Sharp.
good. You're fine there. I'm gonna do the same thing now on your feet.
Okay.
And you know what? I'm not gonna have you take your socks off, but essentially
Okay.
the same thing is that we're gonna do, you know,
Hard.
that would be hard, and you know, I would do the same on the other side, and I would do the same on the bottoms of your feet. I'd be here,
Okay.
here,
Sharp. Sharp.
good,
Sharp. Sharp. Sharp.
good. Do you have any decreased sensation in your feet?
No.
Good. How are your toenails and any
good.
ingrown toenails or anything like that?
I don't believe so. Not at the moment.
Good. Well, again, you know, these are things that, you know, usually an ingrown toenail can become something that becomes infected quickly.
Oh yeah.
You know.
Yeah.
So something that we're going to do is, real quick, is that I'm going to straighten your leg out. I'm just going to push your leg forward, and let me know if you feel any pain in the back of your calf or anywhere else, in your ankle or anywhere else. And it's called the Omen's sign. And you just want to see if a person has normal. If you have the pain back there, it's one of the things, not the only thing though, that's indicative of a blood clot. Do you have any pain when I touch here? Oh, when I do this, does that tickle your foot?
Yeah, it tickles. But no pain.
Good. So I'm just gonna, reflex-wise, I'm just gonna check the reflexes here quick. Good. Good. And do the same thing on your arm. Good. 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 So you're looking good there. You have good reflexes. You notice how you ever trip, find yourself dizzy, are you clumsy at times?
No.
Good, good. Oh, that's excellent. So your reflexes are good. Bones, muscle. So essentially, muscle-wise, I'm just going to feel your muscles here. Clearly, you're working out. How about your knees? Any problems with your knees or ankles?
Nope, no joint pains or anything.
Okay. I want you to take your leg, right? And I want you to just take your right leg and run it down your calf. Good. And do the same thing with your left leg. It's just a neurological assessment. You should be able to do that nice and smoothly, just like you're able to do. And so when you do that again, no pain or problems.
No.
You're able to sit, as far as standing, sitting, you're able to stand without difficulty.
Yep, absolutely.
Good. You do sit-ups.
I do.
Any pain when you do that?
No.
Any difficulty? Not in the abdomen? Nothing?
No, no pain.
Terrific, terrific, terrific. All right, so let's see what we got covered here. We got your head, we got your nose, we got your throat, we got your sinuses, we got your ears, we got your scalp, we got your carotid arteries. I listened to your lungs, your abdomen. I palpated your liver, which again, I did not feel your liver here, which is excellent. Do you consume alcohol? Speaking of liver,
Yep.
how often?
Maybe once a month.
Once a month. And when you consume alcohol, do you ever consume more than 3 drinks at a time?
Yeah.
Yeah?
Yeah.
Okay. Well, I appreciate the honesty. Not much more or more?
No, not too much more now.
Okay. So about once a month? Okay.
Yeah.
Good, good. What about your skin? The next thing I would be looking at is I'd be assessing your skin. So I'd be looking at your skin for unusual moles and things of that nature. And again, your shirt would normally be off at this time. Do you have any family history of cancer in any way?
I do, yeah.
What's that?
So my grandfather he had skin cancer.
Okay. Anyone else in your family with skin cancer?
Not that I know of necessarily, but definitely skin cancer on my grandfather's side.
Okay. And so same thing. I'm looking at your body for unusual rashes or moles or unusually shaped moles for signs of cancer. Typical areas that cancer might appear are here, 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 and here. Have you ever had a bad sunburn?
Oh yeah.
Yeah. I hear you. How many times did you say in your life you've had a bad sunburn?
Probably 3 times I can think of that I can remember clearly.
Good. Well, okay. Sorry about that.
Not good.
No, it's miserable. What was I going to say? Have you ever used a tanning bed?
Never. No.
Never. Good. They're not good for you. There's 2 types of UV rays that are damaging. They're UVA and UVB rays. One causes more skin damage and you to age. The upside of having a nice tan is you look good for a short period of time, but it ages you early. So the idea is to avoid. Let me just look at my time here. The idea is to avoid the sun to the degree that you can. If you can cover up, you should cover up. But if you like to be at the beach, you should wear, if you have a history of skin cancer, you should wear a 58, I believe it's a 56 or above sunblock. And when SPF, exactly, sun protection factor is SPF. 56 or above to put you at the greatest decrease. So if you're using, for each, like if you're at a 30, that increases the amount of penetration, because still, even with it on, they're going to have a certain degree of UV penetration for the sunblock.
Yeah.
With a 30, it's penetrating at like say 3%, and at a 50, it's penetrating at 2%, which is in your case with a history of skin cancer, you're going to want to pay attention to. So in the sun, it would be recommended you stay out of the sun where you can, but wear sunblock, and then you would want to reapply that sunblock each time you go in the water, or if you're sweating more frequently, you would want to reapply sunblock, and at a minimum of every 2 hours, you would want to reapply sunblock, because it does not last for an extensive period of time. So, so terrific. I mean, essentially, we're coming up on time here, so that's our head to toe assessment. I'm just going to now ask you a couple of questions as far as family history goes again. Do you have any family history of liver disease?
No, not to my knowledge, no.
Any family history of pancreatitis?
No.
A family history of diabetes?
I don't believe so.
Okay, good. Diabetes-wise, said that everybody will eventually become a diabetic if they live long enough. So diet-wise, so it really is largely dependent on diet. Exercise is a big part of how we control our pancreas and our absorption of insulin correctly in our body. So you're doing the right thing by exercising. But if not, do you eat a healthy diet? Including vegetables, protein, and a starch on a daily basis.
Definitely, yeah, all the above.
Good. Well, it's part of your exercise regimen. Trying to make sure that you're healthy.
Yep.
Good. Any family history of diabetes that you're aware of?
Not that I'm aware of, no.
Okay. Good. What about family history of abdominal cancer, thyroid cancer, or any other types of cancer?
The only cancer I'm aware of was the skin cancer.
Skin cancer, and that was your grandfather on
mother's side.
Okay, excellent. And is your grandfather still alive today?
He's not. No.
Okay. And what did he pass away from?
He was a smoker, so he had COPD, and ended up getting his pneumonia, and his lungs filled up, and I was all throat.
Okay. And then on your grandmother on your mother's side?
Yeah, she was also a smoker. I believe she had COPD as well, and I believe that's what killed her also.
Okay, and what about on your father's side?
Both grandparents on my father's side are still alive, but both are smokers.
Right, right. And any COPD in either one of them?
Not to my knowledge, no.
Okay, good, good. Okay, and these are things you're going to want to pay attention to. Are you around smokers on a regular basis at any regular period of time?
No, not really. A few friends that vape regularly, but other than that, no, not really.
That was my next question as far as tobacco products go. They even have vapes that do not contain tobacco. So
Yeah.
I didn't ask you, do you vape at all?
No, not really. I have in the past, but not. No.
Tried it, but
Tried it.
Okay.
Yeah.
All right, but you're not a regular vapor.
No.
Okay. Well, I don't recommend it.
Yeah.
So I think that the information is not in on vaping at the moment.
No, not
so,
yet. No, definitely need more time.
Yeah, I mean, but I think there's enough to know that it can't be good for you. It can't be good.
Yeah,
for you.
yeah. Putting anything in your body that's not food definitely is not good for you at this point. From
Okay. Good. Good. And obviously you work out and looking at your arms, whatever. Any use of illicit drugs to make you?
No.
Okay. Good. Good. The next thing is just genital urinary reproductive. You have any problems in the reproductive area as far as as it goes? Good. Good. And if are you sexually active?
Yep.
Do you use protection?
Every time, yeah.
Excellent. Have you had all your inoculations, all your to this age? Have you been?
I have, yeah.
Have you had or vaccinations?
Yeah,
inoculations,
I knew what you meant, yeah.
Have you had an HPV?
Shot?
Yes,
Yeah,
vaccination for
yeah.
HPV.
Yeah, it's like HPV, not
HPV is one of the most common sexually transmitted diseases out there, and so many more people have it, but young men can get it just as much as women. So good that you had that. But at the same time, the best way to protect yourself from these things are to have. Or one of the ways, not the best way. The best way is to have
abstinence.
Abstinence, yes. But to have protected sex, and to not have you ever had in any way what they would call high risk sex with people that have multiple partners? Have you had multiple partners yourself? No. You've been with the
same lady for 6 years.
6 years.
Yeah.
Good. Good. So, and how old are you?
22.
So that makes you with her a long time.
Yeah, since 16-ish.
Terrific. Well, do you have any questions about your health or about your assessment today?
No, I think we hit just about everything I can think of.
Terrific. Well, I'm a little dyslexic. I'm not used to this assessment form, so I hope I covered everything.
Yeah.
But if not, I'll come back and review it. I'm going to do a written narrative, I believe, to this as well, and then I'll come back and I may have to revisit a question or two with you. But overall, I think we have you covered, and a lot to do with assessment is in the questions that you're asked. Is based on the answer. So if you said you had a history of colon cancer, I might delve a little bit more deeply into that, or your family had a history of colon cancer, or you were having problems going to the bathroom, you got blood in your stool, or those types of things. Now those things lead you down a different path on which you're going to assess. But overall, I mean, this would be what I would consider a well check, and I'm just trying to make sure that there's nothing that's gone on or happened that that may be causing you difficulty. But just a couple questions I didn't ask. As weight, have you maintained your weight? Any recent weight loss or gain that was unexpected?
So we recently, the quarantine and stuff hit, so I did lose some weight, but committed to get myself back on track, put all the way back on. So
good. So those things, anything unusual, your body's not supposed to take drastic turns, and if they do, there's something unusual, don't be afraid to point it out to your doctor. You have trouble going to the bathroom, this is not something to be embarrassed about.
Yeah.
Many people do have HPV, and that's something you should get. That's something that you have to manage and be, a respected. Proactive in protecting any, future mates, if that should be the case, or even your current mate. To ensure that things are that you have the best likely outcome for good health in the long term.
Absolutely.
So well, terrific, Liam. Thank you for your time today.
Of course. Yeah, thank
Appreciate
you.
it. And I thank you guys. Bye-bye.